The Mississippi State Department of Health releasing the latest snapshot on death, disease, and overall health this week.
And it is a mixed bag of progress and challenges. State Health Officer Dr. Daniel Edney joins us this morning. Thank you for joining us. And when we look at this report card that your department just released this week, we see that overall the state ranks 48th in overall health in the nation. That is up. What were the positives you took away?
Yes, and that's up significantly from where we were 3 years ago, where we weren't only 50th, but we were 50th by a mile. So closing the gap and moving above two states is related to significant improvements that we're seeing in so many areas. Opioid deaths are down 3 years in a row. Our vaccination rates for our children remain third highest in the country. Our rate of teen birth and teen pregnancy has declined steadily over the last 4 years. Accidental deaths are improving. The years of potential life lost continue to improve each year, which is showing us that the rates of preventable death in Mississippi are improving, which is extremely important to me because those preventable deaths occur a lot in our young people and really keep our life expectancy at the low level of 72 years and 6 months that we're dealing with now. Having that highest rate of preventable death in the country and the lowest life expectancy in the country is just unacceptable. But our HIV rates are trending down. Syphilis rates are back under better control. Congenital syphilis rates, we're getting that back under better control. So a lot of bright spots that have been recognized and have moved us up to 48th health rankings. I tell you, I've never been so proud to be 48th in anything in my life, but I was sure proud to see us go up 3 years in a row in our health rankings. That means Mississippians are healthier than we were.
Yeah, and there's a lot of reasons. Coming out of COVID, I think people maybe took a little closer look at their own personal health and other choices they make. You talked about the opioid deaths going down. We hear about the issue, especially down here and in some of the bigger areas with fentanyl and things like that. But the deaths are going down, so that's good news. That means maybe folks are starting to get the message, I guess?
I think so. We've done a lot of work on primary prevention, which is educating the folks at highest risk, especially educating school-age children and college-age students, in the risk of fentanyl, especially, counterfeit pills that are made of fentanyl that are so deadly. And then the wide distribution of Narcan has saved thousands of lives over the last 5 years. And it's translated nicely into reduction in opioid deaths for 3 years in a row.
So infant mortality rate is still an area of concern in the state. In fact, in this latest report, you reported that it's the highest level in more than a decade. What's contributing to that, and what can be done to reduce this infant mortality rate?
Yeah, that's a great question. It's the most important public health issue that we're dealing with right now at the State Department of Health. That as we improve our maternal infant health rates and reduce mortality rates with pregnant women and our babies, you're going to see us jump much higher in our overall state health rankings. The contributing causes of such severe infant death, a lot of it relates to very, very poor maternal health during pregnancy. And the leading cause of preterm birth is obesity in our state. 44% of our preterm births are of mothers who are at an unhealthy weight. And we lead the nation in preterm births. And preterm births, low gestational weight babies, are extremely high risk of death. So early engagement in prenatal care, better access to prenatal and postpartum care, having more facilitation of transfers at the right levels of risk, which is why we're enacting the obstetrical system of care so that high-risk moms and babies are being cared for at the right level of birthing hospital. All these things working together to try to push down our high rates of maternal and infant death.
Dr. Edney, one of the other issues was also the state being the worst in the nation for firearm deaths. It would seem like bigger cities and bigger metropolitan areas, I guess, or other parts, bigger states would have those numbers. What do you see contributing there?
The largest issue, the leading cause of death for our teenagers aged 15 to 18 is actually homicide. And so those are virtually all firearm related deaths. So a lot of the firearm related deaths do relate to homicide, but we have way too many children who are dying from accidental gun discharges in their home. And this definitely relates to the need for safe storage and proper gun safety. We can reduce our firearm deaths, which will reduce the rate of child death in the state just by normal practices that those of us who care about our Second Amendment rights really guard. That if you're going to own a handgun or a firearm, then you need to understand how to store it properly so children can't get to it, and how to prevent accidental discharge. We year after year after year, we have children dying from accidental gun discharge.
Yeah, I'm really surprised to hear you say that the leading cause of death in that age group is homicides, when I would have thought it would be for sure car wrecks.
Right, or that, or perhaps a fentanyl, opioid,
Yeah,
that type
sure.
of thing, something like that. Yeah.
So
Yeah.
this
And
time,
as
yeah,
we
go ahead.
drop younger than that, then we move to car deaths, and then younger than that, drownings and fire deaths move up in the rankings.
Okay, it's that time of year. A lot of people have sickness going around. I've talked to a lot of people that have had the flu over the last couple of months, but actually Mississippi isn't as exposed to the flu as some of our neighboring states.
That's right. We have been a low to moderate impact state, and we're pretty much coming out of our first wave of influenza. We'll have a second wave. So those who have not gotten their flu shots, you need to go ahead and get them, because the second wave will be here March, April, and May. Last year, the second wave was much worse than the first wave, and the flu shot is effective. We're thankfully not having a dangerous flu season, but we always have 600, 700, 800 people die in Mississippi every year to flu-related illnesses, and those are almost all unvaccinated. So just getting your flu shot, you may still get the flu, but you won't die from the flu. And the one thing that cannot happen, you cannot get the flu from your flu shot. There's no active virus in it. It is safe and very effective, and especially our older folks and those with chronic illnesses and our youngest children need to be protected from influenza, which is deadly every year.
All right, Dr. Daniel Edney with the Mississippi State Department of Health, thank you for joining us. And I feel like we got a good update on the state of health in Mississippi.
Thank you. My pleasure.